Hey guys, welcome back to another episode of Nursing Uncharted. In previous episodes, I've talked with a couple of people about advanced degrees as nurses, and some of the advanced degrees I knew nothing about, but one that I definitely knew about and I've always had a special interest in. This opportunity kind of landed on my lap where I got to meet some pretty interesting people, and the story will come out in this episode, but I am so excited for my next guest. And I'm just going to let her introduce herself and what she does.
Wonderful. Thank you so much for having me, Anne, and for that introduction. My name is Kathryn Williamson, and I am a nurse anesthetist and a nurse educator as well. And I currently work in Atlanta, Georgia. And I do, as Anne does, wear many hats in nursing. As I said, I teach at Emory University. I work in a hospital setting at Piedmont Atlanta Hospital. And then I also work at an outpatient gastroenterology center that we'll talk about a little bit too. So a few different things. And I've been a nurse for since 2005 for 4 years. And then I've been a nurse anesthetist for almost 13 years now.
Nice.
Yeah.
I always think I was literally preparing for this episode at work yesterday and I wrote on my evaluation, like, what are your goals? And I put CRNA question mark.
I
'Cause it
love it.
Yes, because it's always been one of those things, and it just sometimes it feels so unachievable, and, after our conversation, it just it's like, maybe this is a sign that that's, that's the path I should go down. So, I want to dive into what a CRNA is and how to get there, and just basically start at the very beginning and, what those steps look like for you personally. So, what is a CRNA? Let's start with the very basics.
And you're right. It's amazing. Even once you're in nursing like yourself, a lot of experience, a lot of people, we're sort of hidden in the operating rooms and people don't know what we're doing, and patients don't either. So I love to talk about it. But it's one of those advanced practice nursing degrees. And we are advanced practice registered nurses. So nurses with now a doctorate is required. And some of those advanced practice specialties and masters is required, but ours has transitioned fully to doctorate, which honestly, by the time you go through 3 years of schooling, I think you deserve that doctorate, you know what I mean? So I'm happy to see that transition. But what we require to apply for nurse anesthesia school is that you have critical care experience. So typically nurses have at least a few years of experience because when you apply, you need to have at least 1 year of ICU experience.
Okay.
NICU does count for a lot of schools, except NICU and PICU, exactly, which I went to school with a girl who was a NICU nurse, and, she was fantastic, and she wanted to go right back to working with babies, and that's what she did. So we do require critical care experience because you are working in the operating room environment and managing a lot of vasoactive medications, medications that make the blood pressure go up and down, and all different types of drips, so that's why that's really important. But we do have some nurses who've done another field, such as like PACU, emergency room, that's closely related, and then they'll just go get that year of experience.
Okay.
And they
Yeah.
do, in the application process, I would say, because I've been involved in that as well, that you definitely receive credit for that. You know what I mean? Experience in nursing is experience in nursing. And really, the more nursing years of experience you have, usually, the stronger you are in school. So still think about that, Anne,
Yeah.
for sure. But then the school itself is about 3 years because
Okay.
we do require a lot of clinical hours. That's probably what sets us apart. And with that, we receive, similar training to an anesthesiologist. We receive, that many hours of time, in the operating room giving anesthesia. So we are trained in school to work autonomously, independently, and just taking patients through that whole experience of surgery.
And I think that that's really amazing. Like my background I've talked about a little bit, and I think we talked about it when I first met is I did transport, and I felt that that was like amazing that I as a nurse could work so independently and obviously follow like the protocols that are set by the doctors with like standing orders, but then as a CRNA, like a nurse anesthetist, you're like doing all the work. And I think that it's scary, but it also I feel that that drives. I mean, there are different types of people, right? Some people wanna go do this, some people don't, but the people that have that drive to, just work to the fullest of their potential, I really feel that a CRNA as an advanced practice degree is that in a nutshell, like it really allows you to be independent and push yourself to be that strong, independent nurse that just can take charge in a pretty scary situation sometimes, which I think is pretty
No.
cool.
You're right, and it's all about that, in so many parts of nursing, but all about that cool head, you know what I mean? In the operating room, we're sort of positioned at the head of the table, and we always say that if you lose your cool, the whole room's gonna lose their cool,
Yeah.
including the surgeon. So you have to, you have to even when you don't feel it inside, you have to project that confidence. We got this under control, and really, you do have to. You're often directing the surgeon, even. You know what I mean? Like we can't
Oh,
we
yeah.
can't continue with the surgery. The patient's unstable, and they're respecting your opinion, so you really have to be able to find your voice and be
Yeah.
confident and, rely on your clinical skills and all those things that you learn as a nurse, but then also as a nurse anesthetist.
Yeah, and I think that when you were talking about the clinical experience, I think that is something I can speak for myself that deters me from doing that because I struggle with how do you manage that? How do you me as like a single person, how do I still have an income while basically going back to nursing school? Like, is that feasible? Like, how does that look? Was it more of like a part-time thing or what did you kind of have to step away and, you know, put 3 years of your life into just schooling?
So it was funny. I was just top of mind today. I was looking at my social security statement, and there was 1 year where I made $0 since I was like 16 years old, and that's when it was when I
That
was
was
in anesthesia school. And
Yeah.
I did manage to make a little bit of money the first and second year. But so the way my program worked, and most programs work this way, is that usually during the clinical part itself, they really want you to be completely focused on anesthesia because it is like a residency, like a medical residency where it's kind of, 24/7. You really need all
Right.
your energy just for clinicals. Because when you're not in the operating room itself, you're either studying or you're actually in class. So it's kind of 24/7.
Yeah.
But that's really only for about a year and a half, sometimes up to 2 years. Sometimes people are able to do maybe just depending on their program, a little weekend work, pick up a
Oh,
shift or
yeah.
something. Just depends on the program, but a lot of programs, usually at least for 1 year, if you can save. Or what I tell people too is, I mean, you can get on and look what, I mean, the starting salaries are, but also a lot of sign on bonuses that help sort
Right.
of
Oh,
you catch up, you know what I mean?
yeah.
Because there are, especially post-COVID world, with nursing, with advanced practice as well, there's a lot of sign-on bonuses that help
Yeah.
you sort of recover from that little income hit that you have there.
And I think that's a really good point is, this isn't a spur of the moment like yesterday at work. I'm like, I'm gonna do this. It is preparation because you're basically learning anesthesia school in a very condensed time,
Exactly.
So if you look at it in that way, you prepare for that. My dad's always like, "You can come live with us." He would do anything for me to go move back in with them.
Oh, that's so
But so
sweet.
so, I think that it's a very good point to be realistic with the fact that, it is a dedication of your life for, 1, 2, 3 years, whatever that program looks like, and, you need to prepare and be ready to do that. I've talked to a nurse that I worked with on a travel assignment, and her husband went to school, and she said he he dedicated the 3 years, did it, and she's like, we just kinda didn't go on many vacations those years, but it all paid off, and
Exactly.
yeah,
Exactly. It
yeah,
really is. I mean, when you think about the course of your life and really just income aside, but just years of your life, you know what I mean? Years of your working years, it really is a small sacrifice, I think, for something
right,
that you have so many options with is a career in and of itself, nursing in itself, it can do so many
yeah,
things. But also nurse anesthesia, I think you can work in so many settings and work to the full extent of your
yeah,
scope of practice or give anesthesia for cataracts and just give Versed, you know what I mean? So, but it really
yeah,
does, and especially in rural settings, you know what I mean? Because that's really where we're utilized to the full extent of our scope of practice, which is where I sort of started, which was fun. And I've been
mhm,
able, even and now that I'm in the city, I'm in Atlanta, Georgia, I've been able to sort of find that as well. We just because of nurse anesthetists, because anesthesia providers, but there's such a shortage period, we're able to sort of fill that gap, you know what I mean? And
right,
even in cities, rural as well, but also in cities.
and I love that, and why I mean, we kinda grazed right over this, but why for you? What made you go back to school?
I love nursing. I love so much about critical care nursing, but I think even just after a couple years of experience, it was sort of that desire to be able to do a little more. And I shadowed nurse anesthetists, and I just thought, wow, like this is a grown-up job. You know what I mean? I felt like like you said, they have so much responsibility,
Yeah.
and nurses can attain that as well in roles that they're in. For me, I thought that was really exciting because it seems so closely related to, just a lot of what I was doing, but sort of that next step.
Yeah.
And I've found that. I really feel like I've learned a lot more and just sort of, matured as a provider and things like that, because
Yeah.
with that additional responsibility.
And I think I can relate to that in a little bit with what I did with transport is that you take pride in yourself and you
Yeah,
feel like you're doing a good job and you've worked hard to do it. It's very fulfilling when you can really just push yourself to the maximum potential that we have, and I think that this is a great career path for people that have that drive.
absolutely,
Yeah.
absolutely, and that's when people come to shadowing is required. I talk about that because it really is required for a lot of programs.
Okay.
Just because a lot of people don't know what we do, if they haven't, crossed paths with us in their professional life. So it just gives them idea of this is what this is really like. Is this for you? You know what I mean? Is this
Right.
maybe more stressful than you thought it was?
Yeah.
Or we always say it's like feast or famine in our job. We're a lot of times just monitoring, you know what I mean? Some people might
Yeah.
find that dull. I don't because that's when you catch things, you know what I mean?
Yes.
But
Yeah.
but then sometimes it's terrifying. It's like 98%, you know, steady
Yeah.
monitoring and then 2% of giving CPR
Oh,
saving
whoa.
someone. You know what I mean? It can get down to that. So
And as
it's
an
just
ICU nurse,
exactly
that happens, you're not in the
similar.
ICU because 'cause you're the healthiest person, you're so, if people think about how scary that is, you're still in a hospital. You're still in a clinical setting that you have already functioned successfully in. You wouldn't be accepted into a program if you weren't capable of doing the job. So, I think I'm, like, reminding myself of these things too.
Yeah, that's right. That's
Because I think
right.
you and I are gonna have a side conversation after this, and I'm gonna come shadow you, but,
There you go.
so yeah, where do you work now? What setting do you work in right now?
So I do really like I have 3 basically jobs, I would say, and I'm so happy my full-time job allows me to do that, the beauty of
Yeah.
nursing. So I work 3 12s working in a hospital setting from anything from, very sick patients, receiving like not heart surgery, I don't do hearts, but everything in between, having brain surgery, having spine surgery, all those things, down to just common colonoscopies in that setting as well, but usually sicker patients in the hospital setting. And then I work in an outpatient GI center, which is GI gastroenterology. I always use their abbreviations, but I do that as well, usually once a week. And that's in an outpatient clinic where I work independently. And so I love that for different reasons, just being a totally different flow to the day. But in that setting, I'm, interviewing patients and really, seeing them through the entire process. And then I teach as well, so I do that usually 1 day a week, so that's all 5 days of a week. So,
Oh my gosh.
I do a lot online and, respond to emails, but also see the students in person sometimes. So it's just a nice variety, you know?
It is, it's nice, and I know that when we spoke for the first time, the GI center is
Yes.
is something that you hold close to you. Do you feel comfortable sharing that story of,
Yes. No,
what
I think that's so common for nurses. Like when you find that personal tie, it really it refreshes your perspective and gives you that empathy. But so what happened to me was I was working when I was working in Pennsylvania, I was working in a gastroenterology center, an outpatient center, doing colonoscopies and upper endoscopies, and going through my days, enjoying what I'm doing. And then all of a sudden, one of my very close family members, my uncle, developed colon cancer. And it was quite a shock with the 6 siblings my father has. He was one of the youngest and the first to really get anything bad to happen to him. He had stage 4 colon cancer upon his first screening. He was a few years late for his first screening, but not really many. I mean, he died at the age of 57 and had young boys at home and a wife. And it was just really devastating. And, it just
I'm so
really, really
sorry.
made me connect with what I was doing and, this very routine procedure. I realized that people were so scared of it and just really wanted to sort of encourage them. They're doing a great thing. and not share my scary story with them, but just made me really appreciate that their bravery in getting this done, and
Yeah.
obviously encourage my entire family, which they all did. They went and got their colonoscopies and got checked out. And as well as myself, thought, this is really important for me to get taken care of. So it always is, it's great to be able to connect with your patients and empathize
Yeah.
to really what they're going through.
Yeah, and I mean, thank you for sharing that story. When we first met and you shared that, it brought tears to my eyes because as nurses, we do have almost that, not always to the extreme of what, you personally had to go through, but we have that one thing that like sticks with us and like drives us to be the nurse that we are, or why we chose the specialty that we choose. And, I think that it's really important because I mean, I told you I have celiac, which I was told that kind of puts me at a higher risk of
Yeah,
colon cancer. The
yeah,
last thing I want to do is go get a colonoscopy. Like,
exactly.
really, like we
Yeah.
do crazy things to our bodies, but at the end of the day, we don't want someone putting something out
We don't
there,
want to
right?
do it. No, exactly.
It's
We don't want to
it's
do that
like that.
ourselves.
Yeah, it's like that forbidden thing, but, if you can share the knowledge and importance and the calming, you know, just even when you go for that day, it's terrifying. Like, I had an endoscopy, I didn't have a colonoscopy, but even that, it's like, it's scary, and you're in pre-op and you're freaking out. So, to have someone like you come in and just, you know, like, it's fine, it's gonna be
Exactly.
fine.
So we always say it's like it's the best sleep of your life. It really is. And it's, if a lot of people are like, "Oh, I get sick with anesthesia." I'm like, "Not with this anesthesia." This is just propofol we use typically as like our mainstay. And it's really a wonderful drug if given by a licensed anesthesia provider, as it came to fame, unfortunately, with Michael Jackson. Yeah, so many people coming with me with that. I'm like, it's not, I'm here for you. I'm not gonna let you just sleep and walk to the other room. But anyway, so it's a great medicine. It really, there aren't those side effects like with anesthesia gas, like when you have what's called a general anesthetic, for a
Okay.
bigger surgery. So it really, there's no nausea. It's just a nice sleep. You're breathing on your own. You're just receiving a little bit of like supplemental oxygen, usually with like a nasal cannula or a
Mhm.
mask. And sometimes if we're really anxious, if the patient's really anxious, I'll add something like, Versed, which is a little anxiolytic. Um, because I myself, when I got my screen colonoscopy, sure enough, I said, "I'm fine," but the anesthesia provider said, "But your heart rate's 110."
Your vital signs say otherwise.
So on the other side, but I needed some therapeutic conversation myself. But truly, it really is, and it's such a once you get there, we always say the hardest part's over. You did that prep, and the prep has gotten so much better through the years. So it's not, you need to be in your home before, to be close to a bathroom, but it's really not,
Yeah.
as uncomfortable as it used to be. And it's such a quick, easy thing to do to sort of check something off your list of something not to worry about, right?
Yeah.
That you don't have cancer.
I've been wanting to talk about this, and I think this might be a good gateway into it. But when we first had this conversation, I was like, "Well, I'll come to Atlanta, and you can do my colonoscopy." And you're
Awesome.
like, "Yeah, but you live all the way in California." And I'm like, "Well, no, I'm from Pennsylvania." And then you're like, "Wait, I'm from Pennsylvania." So we actually
Craziness.
worked in the same hospital.
The
But
same hospital.
not only that, we is it okay to share?
Yeah, absolutely.
Okay.
Absolutely.
So you have twin girls, and those twin girls were in the NICU when I was working in the NICU. So, and to the
Crazy.
listeners, we don't know each other. Like,
No.
this all happened organically through the company that you work with,
Yeah.
set this meeting up between us having this conversation and gave me a list of like 10 names. I loved your personal story with, the colonoscopies and
Yeah.
colon cancer awareness. And I'm like, this will be great. And then at the end of the call, we have met and I've taken care of your babies. So
It's crazy. It's
the,
crazy. Oh
the
my
nursing
gosh.
world is insane.
It
It's
really is.
so small, but yet so big.
And I always say that to people in your specialty that happens, especially in your specialty, in your state, you get to know everyone. It's like high school or, your grade
Yeah.
school, but not to this level. I mean, that's wild. We're
I
just in
like, I
totally
had like,
different specialties. And
yeah, I wish that would have come organically and we would have been filming during that conversation because I was like, and
what?
everyone on the call was like,
What?
"What?"
I
Like,
know.
how
So
did
So it was, and we both moved around. So we were both
Yeah,
in rural Pennsylvania,
yeah.
providing our care to underserved rural population in Pennsylvania, right there. And it's just
That's
wild. Luckily, I also worked at this facility, also got to go to this NICU, but I think I told you too. So as an anesthesia provider, I was terrified of NICU nurses because when they would come into the operating room, your tiny little preemie babies,
yeah.
we would make them cold, and you would be so upset with us when we brought them
Oh,
back,
yeah.
and I never appreciated why you were so mad. I didn't appreciate because I know about general, you know, facts,
Yeah.
anatomy, physiology, things like that, but not for preemie babies. You know what I mean? I never appreciated NICU nurses so much as when
Oh,
obviously my babies spent a month there. And my one baby was intubated for a week. In her first week of her life, she was one of the sickest babies. She was in that first room I was telling you with the sick
yeah,
babies, and
yeah,
almost stopped my heart, just as an anesthesia provider, as a nurse, just knowing how sick she really was. I
yeah,
learned about jet ventilation for babies then, which were only for super sick adults. That scared
yeah.
me. Anyway, just those nurses really, man, did I see a different side of it when I was a patient's mother myself. And those
It
nurses really,
that's hard.
taught me how to bathe my babies, all these things. Like amazing, amazing NICU nurses.
Yeah,
And
I mean,
yeah,
Nick
and you're one of them.
no, thank you. Thank you so much, and I'm really I'm so thankful that we crossed paths. I do think that there will be lasting communication between us, because if I ever decide to go back to school, you're the first person I'm gonna call.
I love that.
But, it's just so special to have years later. Because what there was that 11 how old are they?
They're
11.
10 and a half
Yeah,
now, they are, yes,
yeah,
and doing wonderfully, and,
love that.
we're so lucky, but that was a scary start to their lives for sure
Yeah,
that we'll never forget, but
yes,
anyway, it was made so much better by your wonderful staff, so
yeah,
so
we had a
thank
great
you.
NICU there, yeah.
Yes.
We have some great nurses there. Unfortunately, I don't work there anymore, but I do miss all of them. The providers there are wonderful. But you brought a good point, like, with the ORs. Something I remember is we would make you turn the heat up, and that would
Yes.
be like
Yes.
they're like, "No, infection control, no," and it's like,
Exactly.
"Sorry."
I know. I know that was
Anyway,
the
yeah.
only warm OR was, like, when those little babies, and even so, it was, like, never warm enough,
Oh, I
but I
know. Yeah.
I didn't realize how important that be keeping them warm was until they're in my little babies are in isolettes, and the nurses, educated me on all those things, and that
See,
was
and it just
wonderful.
made you a more well-rounded
It did.
CRNA. Now,
It
like, you
did.
probably brought that knowledge to people who had no idea why it was important to keep babies warm.
Exactly. They don't appreciate it. They said, "Oh, yeah, I have to be warm." Like, no, this is, like, very important to their survival, you know what I mean? And,
Yeah.
oh, but
Well,
anyway,
I appreciate you allowing that story to be
of
shared with the
course.
viewers. I just think it's really, off topic of, what we're here to talk about is just, like, the nursing community is a very special place, and just the way that we were brought back together, like, 10 and a half years later is absolutely incredible, and
It's
I'm
wild.
grateful for it.
It's wild. I called my mother after we initially spoke and told her about it. She couldn't believe it. So
I
I
don't
said,
think
"Do you
anyone would
remember?
believe it.
She's this beautiful blonde. Do you remember her? Because I'm like, we had some, like, our favorite nurses. You know what I mean? But it's such a blur. I was literally looking
Oh,
through their
yeah.
baby books, like trying to find names.
Yeah.
I'm like, oh, if I just had a picture, yeah,
Well, I remember because I mean, we share the same name, and it's not like my name is not a common first name, especially nowadays. So,
yes,
to have, Annie be a baby, I, like, remember that, and I'm pretty sure I remember what bed they're in, so it's kind of
yeah,
crazy that I would,
yeah.
remember that. So, I'm just so happy. It makes me happy. So,
So
thank you
cool.
for letting
Oh,
us
it's so
share
cool.
that.
Me too. Me too. It's a full circle moment for
It
sure.
it really is, and, these stories are so important, but also something I really wanna highlight is, your passion and your, mission, and that's and I'm sorry if I misspeak about this, but, bringing really colon cancer awareness and you being able to do that as a CRNA with, making people feel more comfortable about having to go through that embarrassing procedure.
Exactly, exactly. We have to take responsibility for that education of the public, right? Of your own family, of the public. And even once they get there, just, this is an important thing that you're doing. And, we just had colon cancer awareness month. I'm involved with our national association as well, the American Association of Nurse Anesthetists, and they really take on sort of putting out those messages like this to the public. Also, letting people know what we do and letting people know that, if you run into a nurse anesthetist, what does that mean? What is that? We really are another advanced practice nurse and work, very autonomously trained to do so. There are tons of us. If you've received anesthesia, you've probably met a nurse anesthetist, even if you didn't know it.
Yeah.
There's so many of us in the country across all states. Pennsylvania was a huge, because of all the rural areas, a ton
Yeah.
of nurse anesthetists were. But even in Georgia, I find a similar, there's so many. And even when we work in a setting with an anesthesiologist, often we're the ones at the bedside,
Right.
giving that anesthesia. And we really make, independent decisions even in the roles that I have, I don't find they're totally different. I work independently, sort of in the outpatient
Yeah.
setting, giving anesthesia for colonoscopies and endoscopies, and I'm fully capable of rescuing that airway if I need to, or whatever. You know what I mean? Whatever that
Right.
is.
Right.
But I also feel like that in the hospital, even though it's great to have colleagues around for help, because those patients are much sicker. But really, we like I said, we're the ones at the bedside often in that operating room giving that anesthesia.
Right, and I mean, that's very true. It's so crazy to think about in Pennsylvania. I know a lot of people that went back to, anesthesia school, and I thought that was the norm, but now being out here on the West Coast, it's actually not as common as what it was in Pennsylvania, and that's a really good point that in rural areas, there's a lack of anesthesiologists. And
Exactly.
they're the one of the higher tier physicians, but that
Exactly.
also brings a lot of money in rural areas,
Exactly,
you know?
exactly, and
Yeah,
that's really what our international association is sort of leading the way on that, just sort of advocating for our role, within the VA, for instance, because there's
okay.
not enough care for our veterans, allowing anesthetists to practice for their full scope and, be able to provide that care, and like you said, in rural areas, Pennsylvania in particular, there are a ton of anesthesia schools there, by the way, nurse anesthesia schools there, which makes sense because there are so many nurse anesthetists.
Yeah,
But also in Georgia, similar. Outside of Atlanta, there's a ton of rural areas, and we are in this
yeah.
state. State associations are really advocating for letting us work to our full scope of practice as well.
I love that. You have really shared a lot of information. I know that people listening to this are gonna be now well educated on what a CRNA is, how to get there, and, like, really how we're looked at or we listen to me, I'm already putting myself
Oh,
how how you're looked
yeah,
at in, in the hospital setting, in the clinic setting. I mean, there's so much variety, and I love that you wear a lot of hats. As you said, nurses, we tend to wear a lot of hats,
me
but
too.
you really do, and I love that you wanna share your knowledge and, the education that you have with people out there curious about this. That's really special, and I really appreciate you doing that.
No, thank you. Thanks for giving me this
Yeah,
opportunity to talk about it. It's wonderful.
of
I
course.
try to get as many nursing students as I have to come shadow me because, just to see, maybe just check this out. You're not going to see it
Yeah.
unless you come. So anyway,
No, I love
but
that.
this is, it's great to put that little nugget in people's heads just in case because we
Yes.
always need more. There's schools are popping up every day, but we really do. We need so many. Can't replace them they're retiring, we can't replace them fast enough, just like nurses too. So
Mhm. Well, I think we're definitely gonna have some talks in the future, and you can, I have to move back in with mom and dad while I do it, but we'll see. You
that's a
never know.
great idea. It's short term pain for long term
Yeah,
gain, right?
yeah,
Yes.
then I get to spend time with my family, right?
Well, and some home cooked meals, maybe that's good too,
Yes.
right?
Yes, yes. So to
Absolutely.
close this up, what is the biggest piece of advice that you would share with someone that is, someone like me questioning it, really you think that's the path you wanna go, but there's some hesitation. What is your, like, best piece of advice?
So I mean, I think shadowing is a great way to go and dig around for some programs to see, where do you, if you want to go to school, do you want to go in California? Do you want to go in Pennsylvania? Think about some of those monetary factors as well. I would
Yeah.
say decreasing your living expenses as much as possible during that time is absolutely like you're already thinking about, which is important.
Mhm.
But really going to shadow, I think is wonderful. I shadowed in an outpatient area where the nurse anesthetist was functioning autonomously, and I thought that was so cool. But it's also neat to see what they're doing in the hospital setting because a lot of times when you first come out of anesthesia school, that's what you tend to do is work in that high acuity setting. until you sort of get your legs about you a little bit, you know. But some people don't. They go right to outpatient and they want to rock on their own from the
Yeah.
start. So it just gives you an idea of what the array of things that you could do. And also, you know, you can get on and look at the job market in your area because, you know, if you're a city person, what do the jobs look like in that area? If you're a rural person, I assure you there are a million jobs. So so
Yeah.
you're good to go. But in the cities, you know, it can look a little different. I had to change up my, you know, when I moved to a city, just different job options. But
Yeah.
anyway, that's important too. You know, where do you want to live? What do
Mhm.
you see yourself doing in 10 years? But if you feel if you know, if you have that, I went to school with a lot of people who were one of the girls I went to school with was I thought at the end of her career, you know, at that time, now I'm in my
Yeah.
mid-40s. If she was in her mid-40s, I'm like, "Aren't you about to retire?" And now I understand. Like, I have lots of working years left, but
Yeah.
she's still working. She paid for all her kids to go to school, you know what I mean? So
Yeah.
you can sort of enter it at
It's
any
never
time
too
of
late.
life. Never too late. And I do think that, like, if you have experience as a nurse, you bring that confidence to anesthesia school, and that's important too.
Yeah. Well, thank you so much. I mean, I'm so glad we met. I'm so glad we crossed paths again, and think you've shared such insight on this. And I really I'm excited for this episode and I'm excited for people's feedback because I think you're gonna motivate a lot of people.
Oh, I hope so. I hope so. And you too. I hope I motivate you too. But thank you. Thank you for this opportunity and for your work as a NICU nurse that obviously, you know, resonated. My babies are doing great. They would say thank you if I didn't just ban them to the upstairs, but but they're doing great.
Well, I'm so glad to hear and I'm sure we'll talk very soon. Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.